Hi, my name is Michelle. I was diagnosed with multiple myeloma in 2016 at the age of 35 when I had a 1 year old and a 5 year old. Like I said, I have two sons that are currently 13 and 9. Um, I'm a mom to them, stay at home mom to them, and do a lot of work with their school and organizations that they belong to. So I'm fully immersed myself into mom life, especially after the cancer diagnosis. It was just kind of important to me to be there for them. It was a long process to get to my diagnosis. I first started complaining of back pain, and the doctors kept brushing it off as being postpartum and that my back wasn't strong from carrying my son. And then I started getting sinus infections, and they were kind of just like, ooh. But then things kind of progressed later in the year. I ended up having a spinal compression fracture that didn't get diagnosed either later in the year too. And I kept saying like, oh, I can't stand up in the morning. They're like, oh, we'll do some physical therapy. So that continued. And then I started getting, which is very kind of not usual for multiple myeloma patients, but I was getting these scabs all over my body, which were painful and itching. And so I finally saw the dermatologist, and she started looking into things. And while that was happening too, I was experiencing these extreme like stomach pains where it was like unbearable, but it would only last for short periods of time. So it wasn't like, and so the doctor finally, I said, I almost drove myself to the emergency room, but ended up getting in the next day, and he just started looking for things too. I was also experiencing a lot of weight loss, which they said that was from breastfeeding. So it was just like a combination, I think, of being postpartum, and that kind of took a little bit longer to get to. Finally, at the end, I said, there's definitely something wrong. Like, this is not right. Just wasn't feeling good. And I tried starting to run again, and I couldn't even run down the block. Um, and finally, I just said, you need to find out what's wrong with me. And that's kind of, they started doing the tests and making an appointment with other doctors. And my general physician finally was doing like a whole slew of tests. And when he finally said, you have multiple myeloma, I just randomly threw this on. I was never expecting this to come back as positive, like showing that I had it. Well, first, I didn't even know what multiple myeloma was. And he just throws it out there. So I'm like, is that cancer? I mean, obviously, he's saying it in a tone that's serious. And he says, yes, it's a blood cancer of the plasma cells. Luckily, he was able to get me into a hematologist oncologist that day where I got my first bone marrow biopsy. But obviously, it's utter shock. And with a 1 year and 5 year old, you start Googling things, and this is really a disease of the elderly. So, and at the time, the prognosis for when you're just researching it was not good. And so I was very scared, very nervous. I did just like the initial 4 months of initial treatment. And it worked fairly well, which they decided to proceed with the stem cell transplant after that. Unfortunately, I was one of the few that after 100 days, like even before 100 days, my numbers started increasing again. So it was kind of back to the drawing board. We kind of let my body recover a little bit more from the stem cell transplant before proceeding with like a second kind of line of treatment. So I was MRD negative for 7 years, and this last January, my numbers started to come out, and I'm MRD positive, but not quite in full relapse yet. So kind of doctors, I was kind of tired of the treatment that I was on as well. So we decided to kind of try something new. I get my numbers back down to hopefully MRD negative. So I took the summer off, which was a little nerve-wracking for me not being on any treatment for the first time for a few months. But I definitely enjoyed my summer with my kids. So that was really nice and not have to worry about getting into the infusion center. Um, and now I'm in the process of trying some new things, and didn't quite go as expected. And I'm having a lot of side effects. So we're navigating those side effects and seeing if I can end up kind of tolerating it, especially with multiple myeloma, where it's definitely just a very kind of specialized um, cancer, and that the treatment plans for individuals are so different, and everyone's journey is so different. And the different types of multiple myeloma even can like affect the way which treatment plan is best for you. So I feel like finding a multiple myeloma specialist is just so important, and people really need to find someone, or even if they don't live in an area where there is one, to hopefully be able to travel to one they can just consult with their local hematologist, oncologist. Um, I've been lucky where I've been able to go to multiple even at times. And I kind of, when I need to make those crucial decisions, get opinions from other specialists as well. And all of my doctors have been so open to that. And I really appreciate that because, um, they it's just such a kind of progressive disease, and all the treatments are up and coming, that everyone kind of has a different opinion. And especially with the side effects now, where my side effects are very uncommon, everyone really doesn't know what to do. So I've been getting multiple opinions on how to proceed with those, and that's really helped as well. But I think like my developing a relationship with Dr. Costello has been such a blessing to me. I'm so glad you're in my life. I wish it wasn't for this circumstance, but I do appreciate you. One thing I really appreciate about her, especially, she is just so knowledgeable and can bring it down into like my terms, so I understand it well. And she places such a key importance on the quality of life, that I love that about her. And it's not just about, getting the cancer down. It's about how are we going to get the cancer down while you still enjoy your life. Dr. Costello and I, who's my multiple myeloma specialist at UC San Diego, and I had this amazing conversation about shared patient decision making. Here's a part of that conversation.
Michelle, I want to ask you this. It's actually for both of you, but I'll start with you, Michelle. So when you first met with Dr. Costello and she's explaining your treatment options to you, when I ask about your experience, I'm really asking, how involved were you in that decision-making process, right? Was it more like, let's have a conversation about your options, or is it like, kind of, this is where you really need to go? And how receptive were you to that information? And what did that experience look like?
Yeah, I mean, I think Dr. Costello just presented me with this is kind of what our standard of care is for when people are diagnosed with multiple myeloma at the time. It's very receptive. I did um, seek a second opinion at the time. We kind of reached out to another multiple myeloma specialist kind of in the vicinity, and went and saw her as well. And she confirmed the same thing. So just went ahead and went with what everyone was recommending.
And so, Dr. Costello, for you, when you are approaching your patients about their treatment options, what is your thoughts? Because now there's this buzzword, which is shared decision making. And so, how do you approach this with your patients when it's like, this is kind of the standard, this is kind of where, based on your clinical determination, where we need to go. But what factors do you consider in that to help them come to that shared decision making process with you?
So, I realized I didn't answer the first part of your last question, which plays into this nicely, which is that every person is different. People
Mhm.
process information differently. People hear information differently. And some people want to know more and some people don't want to know more. So I think an important part of any conversation is to level set and say, what do you want to get out of this conversation, right? What is it that you want to know? And more often than not, the patient has something in mind that the family members there have something different in mind. So I think it's important to kind of gauge the group to some degree to say, what is it that you're hoping to get out of today so that I can make sure I'm not overstepping some of those boundaries? Because some people want data and some people don't. So I think that is the first most important thing. And so once we are then able to kind of establish how much will be shared, I think my job is to kind of give the information as Michelle said, what is the standard of care? What is the typical approach? Once we've kind of laid that groundwork, then we can kind of say, all right, but based on you and the details of your health, your caregiver support, your biology of your disease, there are very specific details that can make my treatment recommendations slightly nuanced for any individual person. And I love that Michelle went and got a second opinion. Like I have no ego. I think when you are diagnosed with something like this that is so absolutely life-changing, you need to feel very confident in what your next approach is going to be. And I think the more people thinking about you, the better. And I mean, I like many myeloma specialists, this is what we do. We do all day, day in and day out. But it's nice to have a fresh set of eyes also. So, just to make sure that there's nothing that's missed, that there's, yesterday's information may have been different from a month ago's research that has been set out. So I think, the approach is standard, but the shared decision making is where things may be slightly different, because I can make all of my recommendations that say, this is what's standard. These are the slight modifications I would make for you. And sometimes the patients will take that information and kind of say, I'll get back to you. Some people will say, let's do this, whatever you say, doc. Some people will say, no, and I'm not in their body. I'm not making decisions for them. I think my job is to help them be as informed as possible so that they can make the best decision for themselves. I may not agree with their decision, but that's not my job, right? My job is to help them come to the best decision that's for them.
I always think that do your research is great. Do your own research. Try to find kind of specialists in your kind of field and doctors that really know and that you trust. Be your own advocate is my number kind of one advice, because no one's paying attention to your file like you should. So you need to know what is best for you too. Like, everyone can give advice, but in the end of the day, it's your life, it's your health. So make the calls yourself. And that kind of goes along with doing your research, like just kind of know what's out there and kind of what you feel is best. And then as far as like mental space, just kind of focus on the positives, look for the wonders in life, and hopefully that joy and beauty will get you through the hard times.